Mrs. Susan Gagnon is a newly arrived resident in your care home. You notice that her nails are long and you take the initiative to perform nail care.
Good morning, Mrs. Gagnon.
Oh, good morning, dear.
My name is Evelyn. I'll be your caretaker for the day.
Okay.
If I understood well, we were going to be doing your nails this morning.
Oh, yeah, they're a little bit long.
Perfect.
Yeah, that would be nice.
I'm going to go get the water and all the material, and I'll be right back.
Okay, yeah.
Regular nail care is essentially done by a PSW. However, if the user is suffering from a chronic illness such as diabetes, heart failure, kidney failure, or some types of paralysis, nail care must be performed by a health professional, such as a foot care nurse or a podiatrist. Fingernail care is part of a daily care regime, and nails must be trimmed on a weekly basis. Toenail trimming is done every 2 to 3 weeks. The usual pre-care steps have been completed beforehand. Prior to starting any intervention, check the user's skin for anomalies. If in doubt, notify the nursing staff. Nail trimming can be traumatic for some people as nails can become ingresses for microorganisms and infections. Given the risk of contamination, nail care materials should be specific to each user.
Okay, can you have your left hand here? We're going to let it soak.
Like this?
Perfect.
Okay.
The PSW lets the fingertips of one hand soak in warm water for a few minutes. Monitor the water temperature. If too hot, the water can damage the skin. After soaking, the PSW takes the hand out of the wash basin and dries it. She asks the user to put her other hand in the water and then performs nail hygiene of the initial hand as follows. She cleans underneath the nails with a nail cleaner, placing each finger on a clean piece of gauze. She makes sure the soil gauzes are discarded.
Perfect. So we'll get this hand out of the water. Okay.
Yeah.
We're just going to put it here on the clean cloth. Okay.
Okay.
Put your next hand in it.
Okay, like this?
All right. Yes, that's perfect. All right, we're going to dry the hand.
She trims the nails in 3 steps from left to right, following the curvature of the nails. Hold each finger firmly to prevent injuries. If necessary, the PSW uses the nail file as follows. She files from the outside in 2 steps and finishes from the center outwards in both directions.
Perfect. So I'm going to clean the nails under.
Okay.
And then I'll be cutting them and then file them. Okay.
Okay.
All right. So we're just going to be cutting them. All right, we're just going to change the gauze here. All right, last 2 toes. Okay. And then
Okay.
we'll put some cream on.
Mm-hmm.
And then your socks back on.
Okay.
Okay.
Mm-hmm.
The PSW then soaks the user's feet. She first changes the water and places a piquet on the floor to catch spills. She soaks 1 foot at a time. Once the first foot has soaked, she sits on a small stool near the user, places a disposable piquet on her thighs, and, if possible, she positions the user's foot on her legs. If this is not possible, it might be preferable to have the user lie back on her bed and place a piquet under her feet. The PSW trims and files the user's toenails using the same method as for the fingernails. After the nail care, the PSW applies moisturizing lotion to the hands and feet. Make sure to have the user put on a pair of socks after the intervention to prevent slipping and falling. Discard the piquet and empty the wash basin. Wash the surfaces and put away the materials so as to leave the area clean and uncluttered.
All right, so we'll put some cream on your foot. Your sock. All right, now we can
Okay.
do your next foot.
Okay. Yeah.